Hey guys, you ever wonder what's in your medical marijuana tincture or your medical marijuana vape cart? Today we're going to talk about it. Hey guys, we're talking medical marijuana here. Tim and Blake, we're at the Zion Medicinal Processing Facility.
Yep.
And the question that I have is that we get all the time is, how do I know what's in my tincture? How do I know what's in my vape cart? So Blake here, we're in front of the analytics machine, and we're going to talk about one of the many in this facility. And if you want to see more of their facility, you can click on our other videos because we have quite a bit of them now. So we want to talk about exactly what's in that jar, what's in the bottle. Yeah. How do we know
what is in there?
How do you know?
That is the question. How do I know? You may have noticed that I feel very confident when I talk about a lot of these things, and that's because, I come from a background of bioanalytical chemistry. I have worked in pharmaceutical companies. I specialized in pharmacokinetics and pharmacodynamics when I was doing that. Dose formulation, so coming up with how we dose things. But the only way to do that is to understand things like, what is a dose response? What is the DMPK? And I'm going to use some acronyms, and you don't need to worry about any of that. But we think about all these things. You can use
all the acronyms you want, because what's important to me and what's important to the providers and the pharmacists that we work with is that we trust the process.
Yes.
We trust the products that we're recommending to our patients. So that the more acronyms you use, the more detailed you can get, that it makes us feel better.
Yeah. And so if you don't want to know what these terms are, you can look them up. Just type in Google pharmaceutical DMPK, which is basically how we determine metabolism and the pharmacokinetics. Or you look up ADME, administration, delivery, metabolism, excretion, right? And so when we start thinking about these different ways that we administer medications, what's it doing inside the body? Where is it being metabolized? How is it coming out? What does that look like? What are the therapeutic effects? So once we start thinking about, how the effects of these things work, what is the dose response? How much is effective amount of CBD? Look, enough studies have come out now that show that if you're below 25 milligrams of CBD and you're an average or a typical sized person, it's not enough. It's not effective.
One or two drops
one or two drops is not going to get you there. And for somebody who's my size, I'm probably going to need a full milliliter or maybe even 1.25 mils, right? In order to get an effect in a 50 mg per mil bottle.
So are you able to dial that in on every single bottle and make it exactly what you want?
Yes, we can. And so one of the things that we do is, so this right here is called an HPLC. This is a high performance liquid chromatography machine. And basically we use this to actually determine our potencies. And so I want to know, say, for instance, the cannabinoid content. Mm-hmm. I want to know how much CBG I have, how much CBD. And then if we are off significantly in our analysis, we can go back and add more of various individual cannabinoids to get us somewhere where we want. And so one of the things that you can see on here is this is essentially a list of 11 cannabinoids. And so we know what the concentrations of these cannabinoids are and where they come out in this line. And so when we inject a random sample, we take a little flower off of, the plant, or we make a vape cart, a concentrate, a tincture, we can inject some of that in here. We can get all of those cannabinoids separated, and it shows us which ones are there and how concentrated they are. And so then when you say to me, well, how do you get 50 milligrams per milliliter in a dose? Because math and analytics teaches us how to do that.
So when I come to you and I say, I want a product developed for a specific condition, you can then go build it.
That's correct.
Or design it.
That's correct. And so, and there's other machines like a GCMS, gas chromatography mass spectrometer, that's used to determine terpenes. And you can also use it to find pesticides. And so how do I know if there's pesticides in my material? Well, a GCMS will tell us that. It'll tell us, you have to put in what ones are there, what ones you're looking for, but then you can find that out. You can look at a headspace mass spectrometer to determine solvents and how much solvent is left, right? And so there's ways to analytically know what is exactly in your materials and what's not in them. And I think it's a very valuable thing. And I think it's something that Zion is doing very, very well. One of the things that and I try to talk pretty objectively about stuff, but I'm very proud of this with Zion. We have 3 full-time scientists who work here. And the reason why we do that specifically is because dosing done right, we want to make sure that you're actually getting what we say you're getting and you're getting the therapy that you're paying for.
Sure. I think that, as a medical provider and as somebody who teaches other medical providers how to do this and how to educate their patients, like it's super important to me that I'm recommending products that are well tested, well thought out, not just for getting high, right? We want patients to feel better. And so when it comes down to all of what we've talked about here and the analytics, I really appreciate the Utah system, frankly, that they have good people on board and that we're doing thorough testing, on our way.